We know from previous years that flu is a significant problem, particularly for those who are very old or very young, who might be immunocompromised or have certain medical conditions. So we've got a responsibility to all our patients to protect them, as well as protecting ourselves and our families. We also know from when the pandemic started that it was significantly worse to have flu and COVID infections at the same time, and in fact in some studies the chances of people dying were doubled from that happening. So just having one would reduce the impact a bit, but having both would protect yourselves, your families and our patients, which is what we're all here to do. I think we've forgotten a little bit about what it was like at the start of the pandemic when we didn't have vaccinations and people hadn't had those vaccinations and then they became unwell. And certainly I think back to patients that I saw and that our clinicians saw face to face who were really ill, even people with relatively minor medical conditions who wouldn't normally be hospitalised or end up on the high dependency unit or intensive care. And that's why it's really important that people have their vaccinations, both patients and staff, so that if you do become unwell and COVID is recirculating again, we know there are still waves now and waves to come, albeit at a lower level than we had before, that there will be some people who will still become significantly unwell. What we also need to remember is that the vaccination effect wears off now for individuals. We don't really know how long it is on an individual basis, but for each of us there is a period at which the previous vaccination will be ineffective and we need the booster to boost our immunity and to protect ourselves again. I think it's really important to think back a few years, and we know in the UK that between 12 to 20,000 people a year died of flu each year prior to the pandemic. Now, one of the effects of us wearing all our PPE and people wearing masks and taking precautions and being socially distanced was that all respiratory virus infections were cut down. And we also know from Australia earlier this year that they did see an effect from a resurgence of flu and more people becoming ill and sometimes significantly ill and hospitalised from flu alone. So there is a concern about the resurgence of flu this year, which makes it doubly important, I guess, that we have our vaccination for flu as well as our vaccination for COVID.